Hey guys, so here's some general advice for those of you that might be experiencing elbow pain in either your day-to-day life or when you try to work out to the level that you want to on a regular basis. So if you want to get to the bottom of your elbow pain, by and large you got to look at factors going on north of the elbow and south of the elbow. Now, north of the elbow we'll go through at a later post, but in this one we'll go through what's going on south, and that's at your hand. Now, what you do at your hand directly affects the elbow because many of the grasping, moving muscles of the hand, they anchor at and around the elbow. So whatever goes on here directly affects that. And those of us that tend to get elbow pain, not necessarily across the board, but by and large, we tend to not have a uniform grip when we grasp things. Those of us that elbow pain will tend to have dead pinkies. We don't engage that outer part of our hand when we grab things. Instead, we favor using our fine motor fingers almost exclusively, and these ones are just sort of like left out, not really doing a lot. And that's a big deal because the muscles that are on this meaty side of the forearm, that's your pinky and ring finger, right around there. The muscles around on this side, that is thumb, index, middle finger. And so if someone is doing a fine motor pincher grip, when instead it would be more useful to have a full grasp, then they're going to end up having a lot of excessive shear forces. It's not going to be a uniform engagement at the elbow. And by and large, you'll end up getting some lateral elbow pain, or what some folks will call tennis elbow. At times, they may feel some pain even on the inside just because the joint is not held steady and it's literally shifting as the hand grasps, as the arm is trying to push and pull objects. So one thing for you to check if you're experiencing some elbow pain when you grip, grasp, or hold things is to see, are your pinkies kicking in? Or are they just going out to lunch like we're holding a martini? It's a pretty big deal also if you consider that 25% of your grip strength is a pinky. And 50% of your grip strength, it's been documented, is your pinky and your ring finger. So you take those two out and you have lost 50% of your grip strength. And besides the fact that you won't be nearly as strong, it has a huge effect on the elbow, both immediately and over time. So if you're having some elbow pain, try and over-engage your pinkies, ease off of perhaps your index fingers, and see, does that change the nature of it? If it does, that is a simple thing to train, and with practice, anything improves. In a later post, we'll talk about what the heck is going on north of the elbow. I hope that helps.